Good afternoon, everyone. Thank you so much for joining us. I'm Becky McGregor, your APS Employee Wellness Coordinator, and you are in Your Benefits Engaged. It's a 2022 open enrollment webinar featuring Cigna. Today we have Carla Sassano from Cigna presenting to you your benefits for 2022. We want to thank Carla. She is virtually coming to us from Colorado. Also online is Andrea Biggs and Rebecca Wheat, two of our benefit specialists. They are going to assist in the chat box with questions should you have them. I want to go over just a couple of house cleaning items. We just ask that you keep your phones and computers muted and your cameras off until the Q&A time. You're more than welcome to unmute and take your camera or put your camera on to ask your questions. Like I mentioned, we are going to be addressing questions in the chat box, but if we find that there's something that's coming up, we'll definitely address it as a group. And again, you do have that Q&A time at the end for anything specific. If you have something a little bit more family or personal specific that we might just ask that you hold back with us, and after we finish the presentation and stop recording, we can address some of those real specific questions that you might have that pertain to your personal situation. Because we definitely want to be here to answer your questions and take care of your needs. So again, thank you for joining us. We appreciate it. We are going to be raffling prizes for those who attend this webinar. So make sure you put your name in that chat box. And with that, I am going to throw this over to Carla Sassano, and I'm going to share her presentation for you all today. Oops, sorry about that, Carla. Let me take it back a couple slides.
Oh, you're fine.
There we go.
All right, so I'll just tell you when to switch over. I appreciate you sharing, and I truly appreciate all of you joining today to learn more about Albuquerque Public Schools Cigna Medical Plan. Go ahead and change it. Okay, so you have the Open Access Plus Network, and our Open Access Plus Network offers direct access to a broad national network of providers. With Open Access Plus, you do have the option to choose a primary care physician, which is highly recommended but is not required. You also do not need a referral to see a specialist. Now, really important, it is always recommended to stay in network to not only keep your costs down, but the plan's costs as well. However, in times that you need it, you can go out of network and will be covered. You do have access to Cigna's national network of labs, X-ray, and radiology centers, plus a 70% potential savings through in-network national labs. Copay and coinsurance, once you meet your deductible, you will pay a portion of covered health care costs and the plan pays the rest. Out-of-pocket maximum means once you meet an annual limit on your payments, your plan pays 100%. So just to note, go ahead and you can go to the next slide. Both your deductible and your out-of-pocket maximum are what's called embedded, which this means that once an individual family member meets their individual deductible, the plan benefits or that coinsurance will kick in. To meet the family out-of-pocket maximum or the absolute most that you're going to pay in an entire plan year, at least 2 family members must meet the family out-of-pocket maximum. All right, so I'm going to review the in-network benefits, but again, you can see there on the slide, you do have out-of-network benefits as well. So your calendar year deductible that I just talked about for individual is $1,000. For family, and family means you and a dependent and children, you and a dependent partner and 100 children, is $2,500. Your calendar year out-of-pocket maximum, so for individual is $5,000. For family is $12,500. As you see down here for physician services, your primary care physician. So those are just like your, when you go just to get a medical concern, $30 copay, and then the plan pays 100%. For a specialist, so that's like cardiologists, dermatologists, those IST doctors, you pay a $60 copay, and then the plan's going to pay 100%. I'm going to review it a little more in depth, but preventive care, the plan's going to pay 100%. For inpatient hospital facility services, your plan pays 80%. Now, do note that Cigna is in alignment with the Presbyterian hospitals. Outpatient facility services, your plan pays 80%. For emergency room, you do have a $450 copay, and then the plan pays 100%. Urgent care, $75 copay, and the plan pays 100%. Ambulance, plan pays 80%. For those laboratory services, independent labs, important to point that out, it's a $30 copay, and then the plan pays 100%. For any type of radiology service, the coverage is the same as a physician service or office visit. Advanced radiological imaging, so that's your MRI, your CAT scans, your PET scans. It's a $175 copay, and then the plan pays 100%. Outpatient facility, $175 copay, and the plan pays 100%. Something really important to note is that behavioral health coverage, your APS plan will cover these in-network services at 100%. That is $0 out of pocket. So effective January 1st, 2021, there will be no patient cost share on mental or behavioral health services. So this means that in-network services and prescription medications for treatment, rehabilitation, prevention, and identification of mental illnesses and substance abuse disorders will not have co-payments, deductibles, or co-insurance in 2022. So again, the APS plan is going to cover these in-network, important to point that out, in-network services at 100%. All right. So one thing else I do want to say prior to this slide is that if you want to know the specifics of where your deductibles apply, please refer to your SBCs. All right, so here we're just talking a quick overview of the claim process. You bring your ID card to the doctor or facility. If you don't have it, it's on your app that I'm going to talk about in just a few minutes. You pay the copay, then the physician will send Cigna your claim, and then Cigna will send you your explanation of benefits, which is also viewable on our portal. And I'm going to discuss this in a little bit. You can go ahead and change. So getting and staying healthy is super important. And that's why your Cigna health plan includes coverage for eligible preventive care services at no additional cost to you when you receive them from a doctor who participates in your plan's network. So this means no money taken from your account, no out-of-pocket cost to you. Covered preventive care services can include, but are not limited to, screenings for blood pressure, cholesterol and diabetes, screenings for colon and rectal cancer, clinical breast exams and mammograms, Pap test, PSA blood tests. And something I really want to point out and super important to note, preventive care can help to avoid future chronic conditions and just help you continue to lead a healthy lifestyle. Go ahead and switch. Something new, exciting, and very convenient is access to virtual preventive wellness screenings. All you need to do is set up an appointment with a board-certified MD Live provider, get your preventive lab work done at an in-network lab, review your results at your virtual appointment with the provider, and if you do have a primary care physician, the MD Live provider will share the results with them. All virtual visits are confidential and HIPAA compliant. Go ahead and switch. With medical and behavioral virtual care, you and your eligible family members can easily connect with board-certified doctors, pediatricians, nurse practitioners, and licensed therapists or psychiatrists without leaving your home or wherever you may be for a wide range of minor medical conditions, including prescriptions when appropriate. Go ahead and switch. So you can connect 24/7 for more than 80 minor medical conditions, such as cold and flu, stomach ache, maybe your kiddo has a pink eye, rashes, and that very annoying reoccurring sinus infection. Go ahead and switch. Licensed counselors and psychiatrists can diagnose, treat, and prescribe most medications for non-emergency behavioral mental health conditions such as depression, addiction, and life changes. You also have access to additional virtual behavioral services as well, including Talkspace, Maru Health, and Ginger. To access these, I'm going to talk a little further about this in a bit. You just go on the MyCigna portal under Find Care. Go ahead and switch. Whenever you need us, you just call the toll-free number located on the back of your Cigna ID card for customer assistance 24 hours a day, 7 days a week, 365 days a year. And please know that language translation is also available. Go ahead and switch. So as a Cigna member, you have access to our highest level of support. This is called Cigna One Guide. It's accessible via our mycigna.com web or the use of our MyCigna app. So One Guide customer service is available live on the phone, or you can use the online chat, which is my favorite. One Guide is Cigna's approach to help you be more engaged with your personal health care and help you reduce your medical costs and really just become a more informed healthcare consumer and give you the personalized support that you need to help you accomplish your health and wellness goals. So you have access to fully integrated search tools that enable you to find local and network doctors and facilities. You can estimate your services and procedure costs. You can also build a health team of providers, which enables quick access to names, addresses, and phone numbers. And One Guide personal guides can also help you with a variety of concerns, including understanding the benefits on your plan, getting treatment, managing chronic conditions, avoiding unexpected bills, and managing life-changing diagnosis. Finally, something that's really cool is that you can view what's called next best actions. These are personalized message right on the home page on our website or your app, and they're relevant just to you and your personal healthcare situation. Go ahead and change. So at Cigna, we want to make certain we provide our members with a variety of programs and services to make their lives healthier. So next, we're going to review some of these resources available as a Cigna member. Nothing is more important than your good health, and that's why there's mycigna.com and the MyCigna app, which is Cigna members' online home for assessment, tools, plan management, medical updates, and much, much more. So on MyCigna, you can find those doctors and medical services, including the behavioral and virtual care that I spoke of earlier. You can view your ID card information. So if you're like me and you constantly forget that card, it's right there on the app, front and back. You can review your coverage or the details of what your plan covers. You can manage and track your claims, compare costs and quality information for doctors and hospitals. You can also access a variety of health and wellness tools and resources, and you can sign up to receive alerts when your new plan documents are available. Next slide. So we not only want to provide you excellent medical care, but we also want to provide you care to get and keep you healthy. You do have access to several healthy rewards discounts. You have tips for healthy pain management, free veteran support, and access to both online and telephonic coaching to help you achieve your wellness goals. Next slide. So with the Cigna 24-hour health information line, you can speak with a nurse who is ready to provide information to help answer your health questions. Again, this toll-free number is printed on the back of the Cigna ID card. We know that if it's not handy, we just pull out that app or get on mycigna.com. And additionally, you can get information to help you decide where and when you should get treatment or if you just need general health information or have a specific health concern. Also, you can listen to hundreds of podcasts to help you stay informed about your health. All of this is available on the MyCigna portal. Next slide. So the health assessment is also accessible on MyCigna. And what it does is it analyzes your answers to a gamified, simple lifestyle questions. It creates a personal health report. You'll be able to view your score on MyCigna homepage. So what's cool is year after year, you can see how you improve. This report includes information, recommendations, and connections with health improvement opportunities. And based on your responses, you might also be invited to participate in an online coaching program or our apps and activities. This is where you can track your goals, connecting your wearable devices. You can also share the results with your physician to work together on your own personal wellness plan. All right, switch slides. All right, you don't have to answer but true or false and think of it in your head, or you can put it in the chat. Studies show that behavioral problems such as depression can contribute to heart disease. Well, these days we've heard a lot about it. We know that this answer is true. Many physical conditions can worsen with stress, substance abuse, and other behavioral issues. So our Cigna Total Behavioral Health Program can help you with that. In addition to your EAP that you have, with Cigna, you'll receive face-to-face sessions with a licensed mental health professional in Cigna's Employee Assistant Program. You also get online, on-demand seminars, as well as community resources and referrals on a range of topics. And these can include like childcare, senior care, pet care, and identity theft support. And another thing that's really cool, and I use one of them, is you can have access to virtual behavioral health care through vendors like Talkspace. And this is digital, I Prevail, and Happify. I use Happify, and it's really kind of keeps me on track when I'm feeling stressed or a little under the weather or not feeling good. Next slide. And available at no additional cost to you is the Cigna Healthy Baby Programs. It supports you in managing your pregnancy and can help keep you and your baby healthy. This program includes assistance with topics such as prenatal care, exercise, stress and depression, and available is also pregnancy-related topics in our 24-hour health information audio library. And you also receive a journal as an expectant mother or your spouse as the expected mother or partner to track your pregnancy. Next slide, please. So if weight, tobacco, or stress is affecting your health or your ability to live an active life, it might be time to make some changes. So a health coach as part of Cigna's Life Management Program can provide you with personalized support to help you learn to manage your weight using a non-diet approach, develop a personal quit plan to become and remain tobacco-free, and understand the sources of your stress, and learn to use coping techniques that help you better manage both on and off the job. You can use either online or telephonic coaching or both, whichever best supports your needs. Next slide. So not only do we want you to get and stay healthy, we want you to be able to afford to do it as well. So as a Cigna member, you get discounts on health products and programs, including nutritional meal delivery services, fitness and gym membership discounts, fitness wearable device discounts, vision care, LASIK surgery, and hearing aid discounts, alternative medicine, so chiropractic, acupuncture discounts, and yoga products and virtual daily burn workout discounts. Next slide. So if you're currently not a member, but would like to maybe explore or ensure that your physician or facility is in network, you can go directly to Cigna.com and click on Find a Doctor, Dentist, or Facility. Go ahead and change. And then you just click on Employer or School and then change. And then you're going to enter your location that you're seeking. And then you choose doctor by type, by name, or a specific facility. Okay, so now we're going to go into the MyCigna portal, which is what you will sign up for as a Cigna customer. And do note that some of these slides is designed just for general use. Your MyCigna will be designed for the unique nature of your plans. So some of these images may not be exactly what you see as a Cigna member, but the navigation is going to be the same.
Nicole, before I advance, I just want to ask, I've been looking, is somebody not muted and typing or something like that? We had some noise and I didn't want it to distract you.
Oh, thank you.
Okay, thank you.
Cool. Go ahead and go to the next slide. All right, so once you sign in or sign up for MyCigna, you just go to mycigna.com. And then once you sign in, you're going to be taken to the home page. So this includes like dynamic, prioritized, and personalized content. Again, it's based on your specific plan. And then information is organized into concise modules. So coverage status, your latest updates. So this would include like if a recent claim came through or any other type of messages. For example, maybe it's the end of the year and you have not gotten your preventive care completed. It's going to remind you. It's also going to have your health team in any type of health assessment and biometrics. All that information will be at the front. And then you can see the little green bubble there. This is access to the personal guide, and it's the Talk With Us chat feature. Like I said, I use it all the time. It's super, super handy, especially like if you're at work, you're trying to find an in-network doctor that's near you. You can do that and do your work at the same time. Go ahead and change. You can also navigate quickly and easy from the links on the top of the home page. So this one is specifying coverage. You never ever have to guess what your plan covers. All right, so this is a closer view of where you can click quick links such as coverage, ID cards, and then find care and cost. So this is what your top homepage is going to look like. Go ahead and change. So this is when you're a MyCigna member, you can find care and costs. So you're going to click on the find care and costs. You can see several options to choose from. This is going to default to your home location. So obviously you don't live in Naperville, Illinois. And then a cool feature is reason for visit. So this is where you can indicate what procedure you're needing care for, and it's going to estimate what you may pay per your plan design. So maybe it's an MRI in the right knee. You can plug that in and it's going to give you an estimated cost. Okay, so as you can see here, when you click on a preference, for example, maybe it's find a provider, you're going to get a list of provider and it's going to go highest quality and it's going to populate the map and location for you. Okay, and then of course, I wanted to make sure that we cover the wellness portion that includes a great amount of health and wellness resources. So just from the homepage, you're going to click on wellness. And then it's going to take you to a page that's very similar to this that includes wellness topics. So you're going to just choose which one you're most interested in. So for example, you might click on exercise and go ahead and go to the next slide. And then there you're going to see your gym membership discounts, but you click on more and it's going to show you all your healthy rewards discounts. Then you're going to individually click on those and it's going to take you to what the discount is. Next slide. And then finally, Cigna wants to ensure that your information is secure. So we provide additional identity verification for account access. All right, so this takes me to the Q&A. You have any questions you want to ask of me, or if there's any questions in the chat, Becky, that
I don't see any questions in the chat, which means you were incredibly thorough. We can definitely open it up for questions here. Please, please put a question in the chat, or you can unmute. And since we don't have a ton of people on the call, you could unmute and put your camera on if you have something specific for Carla. Please do so now. And then we can go over some reminders coming up for open enrollment. Does anybody have a question? Yes. If I have a doctor from Presbyterian already and want to keep her, how do I do that?
Okay, so that's where, and these slides are going to be displayed, right, Becky? Because if not, I can send it to you. But this is where you're going to go to Cigna.com, and then you're going to click on that find a dentist, doctor, or facility, and then you'll go on employer or school. You're going to plug in your location, and then you'll pick the OAP. It just gives you a drop down of what the plan is. Ours is the OAP. And then you can plug in your doctor, and it's going to let you know whether or not he or she's in network.
And just so you know, Christina, Cigna is generally contracted with the Presbyterian medical groups. Yeah. So you could even go to your doctor's website and look to see if they take Cigna. So it's you could do it.
But I don't have to do anything else. Just
no.
As usual, and she doesn't care whether I have Cigna or Presbyterian because they both pay her, right?
No, right, right. So and when you would go in for your next visit, say in 2022, if you did change over to Cigna, you just obviously would have to give them your new insurance information.
Okay.
Yeah.
Yep. Good question. Thank you for asking.
That's a good question. Thank you. Does anybody else have another question? No? Okay, well, if you think of it while I move forward with some of our presentation, just you're more than welcome to ask here. I'm just going to kind of.
Can I ask another?
Sure.
I saw that you have discounts for like fitness facilities. Do you have anything for sports and wellness?
Such as?
New Mexico Sports and Wellness.
New Mexico Sports.
Oh, you know what? While Becky goes through some of these reminders, let me look it up real quick.
Thank you.
What town is it located in? Is it in Albuquerque? Okay, let me look.
Thank you.
Of course.
Another good question. Thank you, Christina. So some closing reminders. These are our insurance-specific information sessions. We have them recorded, and they are placed on our APS Employee Wellness YouTube channel. Tomorrow, we're going to be going over Delta Dental at 7:30 and Davis Vision at 3:30. And then on Friday morning, we have our ASI Flex Medical Spending Savings Account. So those are coming up. But again, these are going to all be recorded and placed on the YouTube channel. We also want to remind you that open enrollment is online through our Winocular Workspace system. And we are going to have another webinar just reviewing and walking you through that online process. And that is Tuesday, October 5th at 3:30. That will be recorded and placed on the YouTube channel as well. We also want to just invite you to the APS Employee Wellness Fair. It's going to be more of a traditional wellness fair this year. It's at Bonifacio, October 7th. That is fall break, and that's from 8 to 3:30. We will have benefit specialists. We will have laptop stations there. If you need assistance with open enrollment, we will have some laptops there to help you with that, and a benefit specialist on hand as well. But again, it is all online, so please don't bring paper. We're not taking paper. And the other things we're going to have at the wellness fair: vaccinations, mammograms, a blood donor drive. We have a lot of local businesses and wellness vendors from around Albuquerque. We're going to have a mini farmers market. We have fitness demos from like 10 gyms. It's going to be so fun. So we invite you to join us on October 7th from 8 to 3:30. And that information is on the aps.edu Human Resource Benefit page. It's also on the intranet, but we realized that has been intermittent, so we also transferred all that information to another location for you to find it. So I already told you to put your name in that chat box. So thank you for doing that. We appreciate you all joining us today to hear about Cigna. And we also appreciate you engaging in your health and wellness. So your theme this year is Your Benefits Engaged. And the way you do that is first by connecting with APS Employee Wellness and Benefits. We are on social media, Facebook, Instagram, Twitter, and our YouTube channel. We invite you to join us there if you do use social media. I put out monthly newsletters. We are in the Perspective every other week with announcements on new programs and things coming up. We also have the Employee Wellness Google event calendar, as you know, because you got your link to this information session through that. And we are on the intranet. We have a whole section under Employee Wellness. You can find a lot of information on your benefits, both medical and non-medical, on aps.edu/human resources. If you just go to the aps.edu page and scroll down where it says employees and benefits, and you click that, it's going to give you all the information you need. So we appreciate you engaging. Please share the information and take care of your health. With that, I am going to stop sharing my screen and again ask if there is any other questions. And I will stop recording. And then once again, thank you for attending. We appreciate it.
All right, Becky, I pulled up the gyms in Albuquerque.